Now, the UK government's response to coronavirus has also come under scrutiny. There has been criticism after Prime Minister Boris Johnson said that the country was moving out of the containment phase and into a delay phase. Last Friday, the UK government's chief scientific advisor, Sir Patrick Vallance, said a degree of herd immunity will help reduce the transmission of COVID-19. And what is that supposed to mean? To discuss it all, I'm joined from Washington again by Eric Ding, an epidemiologist and health economist at the Harvard Chan School of Public Health. And on the phone is Professor Cui Hongjian, Director of the Department of European Studies at the China Institute of International Studies. Eric, I want to go to you first. Boris Johnson, the Prime Minister of the UK, said the UK will introduce staged interventions, starting with asking people with a cough or temperature to self-isolate for 7 days. And in a statement, the UK government has said, and I quote, "If we introduce this next stage too early, the measures will not protect us at the time of greatest risk, but could have a huge social impact. We need to time this properly. Continue to do the right thing at the right time so we get the maximum effect for delaying the virus." Your thought, Professor Ding?
Yeah, I think asking people to self-isolate themselves for 7 days is potentially a good idea. But the tricky thing is, this is not a foolproof idea because this virus is known to actually spread asymptomatically, which means even with no symptoms, you can still be transmitting the virus in the early phases of this infection. And that is what makes containment for this virus so tricky. Also, it has an incubation time. This virus has an incubation time of on average 7 days, but could also be 14 or 15 days. And that also makes containment so tricky because you can isolate yourself for 15 days, and even if you don't have symptoms, you could have it once you come out of a 14-day quarantine. And that also, again, makes all this ever more difficult for containment.
So, Professor Cui, what is your take on Prime Minister Boris Johnson's staged intervention strategy?
Also, it's a very, very, natural result for this, change of the judgment from British government on this current situation in UK, especially as we know, according to this so-called three-steps strategy for British government. Now it's already from the first stage of containment and to the second one, which means that just a delay. So what does it mean? Which means that there is not any way to stop the virus. So now I think that the British government tried to transfer some messages to the public, say that, okay, now we need to defend firstly, and then we need to have some more time to find out the way for the space for the supply of the medical materials, and also to deal with any kind of very dangerous situation, especially just like what happened at the early period in Wuhan of China. So I can understand, but of course, regarding to this so-called herd immunity logic, I think that it's just maybe a skill from the government to try to persuade the British people to follow, the strategy of government and not do something wrong, just like this.
So Eric, excuse my ignorance, but what exactly is herd mentality, and will that work at all?
So herd immunity is a strategy that only supposed to be done when you have a vaccine. I want to be clear. Herd immunity is not a strategy when you don't have a vaccine. The concept is that if you're in a crowded room and you have the virus, and the chance of it skipping over to me on the other side of the room is much smaller if everyone in the middle of the room has immunity. Basically, they form a wall between you on your far side and me. But if very few people have it, then it can transmit between person to person and bounce to me. But this only works, first of all, once you have up to like 60 or 70% at minimum immune. And secondly, you do not want 60 or 70% of your population, like 60 million people in the UK to be sick so that you help protect the remaining 40%? Because this virus has a 1 to 3% mortality, which is 10 times or 30 times higher than the flu. That kind of level of mortality on 60% of your population in order to protect the remaining 40 is not a strategy unless you have a vaccine. You don't want to get there by making people sick so that you get there. Does that make sense? It's just so dangerous of a strategy without a vaccine.
So Professor Cui, I want to read you a comment, a reaction from a prominent editor in the UK, Richard Horton, editor-in-chief of the prominent medical journal, The Lancet, described the herd mentality on Twitter as, quote, a grave error. He said the goal of the UK government seems to have been, employing this herd immunity strategy is to delay urgent action to allow an epidemic to infect a large number of people. Instead, the goal of the government of the UK should have been to save lives. Do you agree with that assessment?
Certainly, just like I mentioned before, that I don't think that this herd immunity is just a policy from the UK government. And even I can heard that now there are a lot of debate within British people, and we can find out more and more, criticisms from not only the people and also some, politicians and some even experts. So I think now the question is, once UK government try to, strengthen or some restrictions or some measures, how could help it is done? What I mean is, as we know, for UK government, it need to deal with the relations with people. Once it try to have the more, strict measures, because as we understand it, that there's a very, very, different relations between the people and the government in UK. So I can understand that now, perhaps the next step, for the British government, is we'll have some more, measures, including maybe the shutdown of schools and also the cancellation of, some public meetings and so on. So I can understand maybe this is kind of strategy or kind of tactical from Mr. Johnson and his government.
So Professor Cui, I want to stay with you. Let's talk about Europe's situation in general. Italy, its country's new positive cases continue to rise. The country has right now the most number of cases and the most number of deaths outside China. What lessons and experiences of China can be offered to our friends in Italy and indeed across Europe?
Indeed, as we all know that now the situation in Italy is as bad as possible, and if we can, in case, we can find that maybe firstly, the government and the people, they should trying to find out a more cooperative relations, because as we know, because of the debate between the local government, the central government, between people and the government, and the Italian government lost some opportunity at the very early, beginning of this, this problem. And then secondly, how could Italy find out its own way to deal with it? Yes, at the very beginning, Italian government had some measures to, close down and shut down some, vocations. But now the problem is how could it help implementation? And the third is, I think now, yes, it looks like the Italian situation much more like what happened in Wuhan in China. So I think hopefully this week or maybe next week, under the help from China, from international community, and this situation in Italy will become better than now. Once it happens, hopefully, in the next months, there will be a better situation there.
That's certainly the hope. Eric Ding, we have about 1 minute left. What will be your advice from the medical perspective on the Italians and the Europeans fighting this epidemic? What must they do right now before things get even worse?
Yeah, I think first of all, what they're doing now in terms of containment in lockdowns are really, really essential, because they cannot lose complete control of this epidemic. In northern Italy, in Lombardy, they have perhaps potentially, but they have to flatten the curve. And that flattening the curve means slowing down the epidemic so it doesn't go over hospital system capacity. Because Lombardy has 8% mortality right now, much higher than China, because they've lost control. Other countries have to learn that lesson. There's a short-term pain, but there's a long-term gain in which you actually can save thousands of lives and perhaps even tens of thousands of lives if you do the containment as strictly as possible early on.
All right, short-term pain for long-term gain. Hopefully, our friends in Italy will contain this virus. I want to thank both of you, Eric Ding from Harvard Chen Public School of Health and also Professor Cui Hongjian from the Chinese Institute of International Studies. Thank you both so much. And that will do it for this edition of The Point. As always, follow us on Facebook and Twitter using handle The Point with Alex. Download CGTN app to watch our show or go to YouTube and look for CGTN The Point. Thank you for watching. I'm Wang in Beijing.